Hey everyone, welcome back. This is kind of a special episode that is in response to a comment. Someone had left a comment on an episode that I uploaded today on YouTube, and they said that they haven't been a fan of harm reduction, but they're open to hearing more and learning more about it. So I was like, okay, we're going to do a special episode for people who are not a fan of harm reduction, but they are open to hearing more. Okay, so this episode is for you. This isn't for people who are deep in the movement, but of course you're always welcome to stay. It's for people who are skeptical but curious, maybe you're even a little conflicted. Opening your mind is a whole lot harder than doubling down on what you already believe, and that is what I am so used to dealing with. I will always take time to talk with people who are respectful and just interested in hearing more and learning more, because there is so much misinformation out there, so it's kind of hard to know what to believe, and then there's propaganda and stigma and all the bullshit that goes with it. What I want to do today is kind of walk you through how it works and why so many of us do fight for it. But more importantly, I really want to make it make sense. I want to show you why this isn't about enabling or just letting people use. It's about saving lives in the world where the system's decisions, the government's decisions has made drug use more deadly than ever, not the people using the drugs. We'll get into how the overdose crisis got this bad and what we're seeing in places like Philly right now. So let's get into it. So just a heads up, in this episode, I don't go into the actual history of harm reduction, because I don't think people who aren't fans of harm reduction really care about the people who built the movement. I don't believe that they're listening to hear about underground activists or mutual aid networks, but I do care, and I care a lot, and I think that the history is important. So it is something that I will start sharing more of. I want to do like a criminalization series. I want to do a harm reduction history series, and I'm thinking what I'll do, since I want to do so many things, is have an episode that has like multiple different segments of like with things like that, and I'll do a harm reduction history fact of the week and a criminalization fact of the week. But I just wanted to say that that is a series I have on my list, diving into the real roots of harm reduction, the key people who helped build it, and the parts of the movement that rarely get talked about in mainstream recovery spaces. Harm reduction isn't some trendy buzzword. It's a movement. It's a life-saving, community-led, resistant-fueled movement. Understanding where we came from is going to help explain where things went wrong. So obviously substance use didn't start in the 60s. It didn't start during the so-called crack epidemic. It didn't start when Purdue Pharma was pumping out the OCs, right? Humans have been altering their consciousness for literally thousands of years. There's evidence of fermented beverages in China dating back to 7000 BC. The Sumerians, one of the earliest civilizations with written language, had a word for opium, probably going to totally mess it up, but hulgil, which means the joy plant. They had that spot on, right? And that was around 3400 BC. Ancient Egyptians used cannabis for pain relief and ritual. Mesoamerican cultures used psilocybin mushrooms in sacred ceremonies. Indigenous communities across the globe have used tobacco, peyote, and other plant medicines for centuries. Like, this isn't new. This isn't modern. Altering our mental state has been something humans have always done for healing, for connection, for coping, and yes, for pleasure and escape, right? So if humans have always used substances, what changed? Why is it so much more dangerous now? And the answer isn't the drugs themselves, it's the laws. Systems that have criminalized and punished and pushed people into the shadows of what that is what has made drug use so deadly. All right, so let's jump forward to a time that most of us have heard about, and that is alcohol prohibition in the 1920s, right? So the US government banned alcohol with the 18th Amendment, thinking it would clean up society, reduce crime, and create order. But guess what? It didn't. So what happened instead? I mean, we already know. People kept drinking. They just did it underground, right? In speakeasies and hidden stills and unregulated setups. The alcohol wasn't tested, it wasn't consistent, and people started getting sick. Then, of course, the government makes it worse. They started poisoning industrial alcohol, knowing that bootleggers would use it to make drinks, and people died. And that was on purpose. They knew that was going to happen, and it was like a campaign of, if you're going to drink, you're going to suffer the consequence. And with the illegal drug supply that's out there today, people don't know if they're getting illicit fentanyl, xylazine, nitazine, medetimidine. Like, there's so much shit out there now, and honestly, we're not that far removed from poisoning alcohol to punish people, because today with criminalization, it poisons the supply without the government needing to lift a finger, and that's what brings us to what's happening right now. All right, so let's connect the dots, right? The current overdose crisis didn't just appear out of thin air. It followed a very specific path. First, we had what was considered an overprescribing of opioids like Oxycontin. So then came the crackdown. Doctors stopped writing scripts. Patients were cut off, but their pain and their dependence didn't disappear, so people would turn to street drugs like heroin, right? Heroin filled the gap for a while, but then it became more profitable to press pills or cut powders with illicit fent. And it's cheap, it's potent, and it's easy to transport. But illicit fent also made overdoses spike dramatically. It was stronger, it was unpredictable, and it required precise dosing, which is something that just doesn't exist in underground markets. Also, I think a lot of times when people hear illicit fentanyl, they think of one drug, but that's not the reality, right? And I always say fentanyl wrong. It's like fentanyl, but I just feel like I sound weird saying it that way. Right now, there's at least 1,400 known fentanyl-related compounds, and each analog hits differently. Like, some knock you out fast, some slow you down. And what's going on is producers of these are like in a chemical arms race, right? So when one analog gets banned, a dozen more spring up because chemists that are making it only have to alter the structure a little bit. So you always have like the government behind in what they're scheduling, and then the testing supplies and such, they're behind too. But every time that they ban one, it doesn't help. It actually just makes the supply more deadly, because now we have new analogs coming about. And then right now you get like a street supply cocktail, and one single pill can have illicit fent, it can have carfent, xylazine, medetimidine, nitazines, all in one. And it's like, yes, the initial illicit fent spikes were deadly when the heroin was starting to go away and everything was starting to get the fent in it, right? But now it's infinitely more unpredictable, since the government, everything you hear, like everything, all the politics, all the headlines are all about, fentanyl, everything's about, deadly fentanyl. And since everybody has been going after that, it's just become more potent and more deadly. Those early versions, they may have been potent then too, but they were occasionally consistent. Today, it's just like chemical roulette, like you have no clue. The CDC report confirmed the chaos, because while classic illicit fentanyl has stabilized, even more potent analogs like the carfentanil keep emerging, and with them, overdoses skyrocket. Then came xylazine, which is a veterinary sedative that was added to stretch the illicit fent further. And now we're seeing medetimidine in the supply, especially in cities like Philly. A study that was published in Drug and Alcohol Dependence in April of 2025 this year found that while illicit fentanyl levels are declining in street samples, medetimidine levels are going up. So this means that people are unknowingly using tranquilizers that don't respond to naloxone, right? Because naloxone is for opioids, it's not for tranquilizers. So the result is obviously slower breathing, deeper sedation, and more complex to reverse overdoses. I want to talk about rescue breathing, because with the drug supply the way that it is now, this step can make all the difference, especially if you don't have naloxone on you yet. You've sent someone like, hey, I got it in my car, go get it, or you've had to call 911. So if someone is overdosing, oxygen is priority number one, right? Illicit fentanyl and its analogs, they kill by stopping the breathing. So even before the naloxone kicks in, or if you don't have it, rescue breaths can help keep their brain alive. So you're going to tilt their head back, pinch their nose, make a seal over their mouth the best that you can, and give one full breath every 5 seconds. You're going to watch for the chest to rise. If it's not rising, try to reposition them and keep going. 1 breath for every 5 seconds until they start breathing again. The naloxone kicks in or EMS arrives. If you do have naloxone, give a breath first and then give the naloxone. Then keep breathing for them. The naloxone can take a few minutes to work, so you don't have to just sit there waiting. You can be doing the rescue breaths while you're waiting the 2 to 3 minutes for the naloxone to kick in. 2 to 3 minutes can feel like a really long time when you're just waiting for someone to wake up, and sometimes people keep giving people more doses of naloxone that they actually don't really need. So I cannot stress that enough. Rescue breaths with this drug supply are just so important. And like, this is a direct result. Like, this landscape that we have now is a direct result of banning, cracking down, and trying to police our way out of a public health issue. If we had regulated options, if we had a safe supply, we wouldn't be seeing overdoses involving 5 or more substances. People would know what they're taking, and we'd be able to respond appropriately. And obviously, we'd have a shot at saving more lives. And you know what? I know this sounds crazy, but we would love to have the overdose rates we had during the peak Oxycontin era. No one's saying that that era was super safe, but it was a hell of a lot safer than this. And since we know our government is not going to allow a safe supply anytime soon, safe consumption sites. So what does a legal safe consumption site look like? No, it's not a party where everyone's just doing drugs. Picture like private booths, sterile supplies, and trained staff. People come in and they use, and there's people there that to help if anything goes wrong, and they get to walk away still living after they use. It's quite fucking fantastic, right? If they overdose, there's someone to reverse it. To date, there has never been an overdose death in a safe consumption site. There's less syringe litter in public parks and public restrooms. There's reduced public drug use. There's a decrease in emergency room visits. There's a decrease in 911 calls. And in those settings, it starts to build a trust between people who use drugs and health services. For example, there's a study that people who access safe syringe programs are 5 times more likely to enter treatment. I should know some about safe consumption sites, but I don't. But I do know that also, I don't know the number, but I know that there are studies that show it does increase the likelihood of people going to treatment. This isn't something that's new either. It's been working in other countries for decades now, and it's not about promoting use. It's not like people are going to be like, oh, now that I can go into this doctory looking place, I'm going to go shoot some heroin. Like, no, it's about reducing death. Because if someone is going to use, because we know that people are going to use drugs no matter what, there's nothing that's never going to end. That's been a part of human culture, like we talked about in the beginning of this, right? If someone is going to use, wouldn't you rather them not use on the street, right? And actually not have to die just because they did use, right? We let people drink in bars. It's obviously a much more chill and social safe consumption site, but you have the bartender who makes sure that people don't drive home after they're intoxicated. They're getting labeled liquor, like they know what they're getting. They know percentages and such. Like there's a lot that we do with alcohol that we could do with drugs, but with drugs it would be a much more medical looking type vibe, much different than the bar setting. But if you think about it, a bar is like a safe consumption site for alcohol. I just want to run through the core principles really quickly. So the core principles are human rights and dignity, right? People who use drugs deserve to be treated like people. Pragmatism, people are going to use substances, so let's reduce the risk, reducing the harm, right? Not the use. So the goal is to help prevent illnesses, diseases, death, injury, like all these risk factors that come with drug use and drug use being illegal. Hierarchy of needs, like survival is more urgent than sobriety. Participant-driven goals, so people should have agency over their own care. It's not like when you walk into an AA meeting and they say, your thinking is what got you here, so you need to give up your will and you can't think for yourself because your thinker is broken, right? Context matters, so race, class, trauma, and policy all shape risk. Non-judgmental support, so no shame, no strings attached, and evidence-based, like things that have data and information behind it. Like let the data lead us. Like we know what's working. It's all in front of us. What the fuck are we doing still leading with 12-step, right? But I can picture the comments now. But okay, but what about the lying, the stealing, the manipulation? Where's the harm reduction for that? And part of that is stigma, right? Like we take the worst case behaviors from some of the worst moments in people's lives, and then we slap that label on everyone else who uses substances, whether they're in chaotic use or not. But the truth is that there are a ton of people who use drugs and still show up for work, they still care for their families, and they still treat people with respect. Not every person in chaotic use lies. Not every person who is in chaotic use steals. But when it does happen, because yes, I am someone who I lied, I stole, like I was a shitty person when I was using, but that came from desperation, not my character. Like it wasn't about me being a bad person. That was me being trapped in survival mode, trying not to be sick, trying to make sure I had a roof over my head, to get something in my stomach to eat, to have cigarettes, right? I needed my Newports back then. Not wanting to be sick, like trying to prevent withdrawal. I mean, if you've been there, you've been there, but that is what that scarcity does, right? And what happens when the only way to feel okay is to risk your freedom or your life? Well, a lot of that chaos that comes, and it's not like we can say to our friends, typically, like most of us can't say to our family members, like, hey, I really need $20 so I can buy a bag because I'm super sick, because they're going to say no. So of course we're going to lie because we're trying not to be sick. Like if we could be honest, more people probably would, but they're not, because there's just so much shame and stigma that comes with it. Like part of, with the safe supply and taking like a more like pragmatic approach of like, okay, like people are going to use drugs like no matter what. It's not a moral failing. People have been using drugs since the beginning of time, and what's made it more deadly and more complicated is the criminalization of the drugs, because that's where all the bad shit really starts. And I'm not saying that because let's look at alcohol. Alcohol is legal. I'm not saying that all of the issues go away because alcohol is legal, right? Like you have more people dying from alcohol than you do from opiate use disorder. So, but they're never dying because they don't know what they're drinking, right? They always are able to know exactly what is in their supply, how much they're getting at a time, and that makes a difference. And just to go back to what people would categorize as quote unquote addict behaviors, every day waking up sick as hell, right? Like sweating, shaking, shitting, vomiting, like desperate. You're not desperate to get high, but you're desperate to just feel normal, just to feel baseline. And the only way out is a drug that might be fake. Someone could rip you off. It might be too weak. It might be too strong, and you've got no money, and you have no safe place to land, and you have no one left to call. What would you do? That is that desperation. It's not about excusing the harm, but it's about understanding the context, right? People who use drugs, the people that do lie and steal, like they're not doing it because that's what they want to do. If we can understand why something happens, then we can start to change the conditions that produce that. And that is what harm reduction does, because when people have access to a safe supply, when they have access to things like medications like methadone or Suboxone, when they have supervised consumption sites, when there's housing first options, meaning that, in a lot of sober livings, obviously you have to be sober to live in them. With housing first options, what shows up on your P test isn't a deciding factor if you have a roof over your head. When people have access to consistent healthcare, when they're able to go to places like safe consumption sites and interact with non-judgmental staff, it makes a difference. And when people have actual support without the shame, without the, when do you think you're going to get into treatment? When do you think you're going to do this? And what happens? The chaos starts to calm down. Like, people don't have to steal if their needs are met. They don't have to lie if they're not being judged. If they could just call someone and say, hey dude, like I'm really sick, I need $20. If the person doesn't have it, right? The person's like, listen, like dude, I'm sorry, I don't have it. Or even if the person's boundary is that I don't want to give this person money. But you can say something like, I don't have it. I told you last time I'm not going to give you money. But when you do get it and you do get your stuff, do me a favor, give me a call when you're using. That way I can make sure that you're safe. Things like that, letting people know that you actually give a shit what happens to them. And then you're more likely to be someone that they're going to reach out to if and when they do want to get help, because they know that you're not going to judge them because you didn't judge them when they were using. We don't need to punish people into honesty. We need to create conditions where honesty feels safe again. And obviously harm reduction, it can't solve every problem, but it removes the fuel behind a lot of them. A lot of those behaviors that people find so triggering, because when people have stability and options and when they're not constantly in survival mode, they get to show up as themselves, not just as their symptoms. And that's the person most of us are trying to reach anyways. If you've made it this far, thank you. And honestly, I mean that. I just want to leave you with this truth. People are always going to use drugs. They always have. From ancient temples to modern raves to your nana's medicine cabinet, right? Drug use isn't just some fringe behavior. It's very, very human. And trying to arrest our way out of that hasn't worked. We've tried it for over 50 years. And what has that gotten us? I mean, look around. We have more overdose deaths than ever, right? We have more dangerous street drugs. The supply is more unpredictable and more dangerous than ever, right? We have more grieving families, and majority of people are getting punished and not getting help. I do want to do like a full history of like criminalization at some point, who knows, whenever I'll get to it. But harm reduction does save lives. It does make sense. And in the US, with the drug policies that we have, harm reduction is what we have to battle it, right? And it does work. And you know, harm reduction isn't a perfect solution, but we don't need a perfect solution. We just need a less deadly one, a more humane one. Because whether a person is ready to stop using or not, they're still a person and they still matter, and they still deserve to live long enough to make choices and have choices. And that's what harm reduction is. It's not enabling anything but life, and it just makes sense. So, you know, I don't expect anyone to have changed their mind, but I do hope that I can at least have planted a seed or put a little crack in like all the bullshit things that we've been told over and over again. Because once that little crack is open or that little seed is planted, it becomes a whole lot easier to see people for who they are and not like the substances that they use, because we really just need to humanize it, because the media, the stigma, it's made it to where people don't look at people who use drugs as humans anymore, and it's pretty disgusting, honestly. But until next time, stay human, stay curious, and as always, burn the stigma.